So it's always hard to be the last. I told you that yesterday, and I'm again the last one. So of course I will bring some things that my colleagues have already presented, and I'll try to add a few others to complement the good presentations we've testified. To start with, I represent an organization called ICLEI, Local Governments for Sustainability. This is a global city network, a global subnational governments association based in Bonn, in Germany. And I run the South American chapter, which has 4 offices and about 150 subnational governments as members. Their headquarters in São Paulo, but we do have Colombia and Argentina as satellite offices to support our engagement throughout South America. And actually, ICLEI is the organization which represents the constituency of the local governments towards the UN conventions, the Climate Convention, the Biodiversity Convention, Desertification Convention. There are other coming, such as the Ocean Convention. So ICLEI sits in as the official voice of local governments. That brings us to one of the important points I want to make, which is the advocacy piece of all the work that is provided by scientists, researchers, and the academy. To start with, of course, this is already on the table, and you're all addressing this, but it is still important to insist that climate emergency is actually also a public health issue. And this is not stated enough by local leaders, by citizens. This is not recognized enough in the international agreements, in different public communication pieces. So there is the necessity for us to really insist in that, so people can comprehend and also appropriate that in a more clear and common and frequent way. And that is the multi-dimension. We could add several different and other possibilities here, but I chose 4 of them. Of course, food insecurity and malnutrition is one very important correlation. Physical health, due to different events such as flooding, such as heavy rains, or even heat waves. Mental health, of course, climate change is providing us with that sensation of insecurity and fragility that keeps there with us, and especially within young people all the time, and affects our way of living, especially in the housing perspective, and even more especially if you look at the global south conditions of housing in big cities. Then when you look at the global agreements, and there are several of them, this is one challenge for us all. When you look at the international system, you think it is one thing, the UN is one thing. And then you realize that there are different agreements for each theme that you want to address and influence. And then it is almost impossible to advocate well towards the UN system, because each of those agreements have its own body, its own secretariat, its own leadership, its own bureaucratic way forward, that it is not easy to navigate. And if you look at those, health is only explicitly considered in the Sustainable Development Goals. It is not that health is not on the others, but it's in a secondary, maybe tertiary, maybe too marginalized space. And this is a problem. This is a problem, because then the funds, the policies, the cooperation programs, all the efforts that the international community is placing forward is going somewhere else, not having health as a central issue in this case of the climate emergency, the climate crisis. Then there is a task for us all. We should then try to bring this communication that health is a consequence and part of the climate change crisis, and therefore should be central for the solution of the climate change crisis in every international agreement. And I would like to highlight probably the biodiversity and the climate and the new urban agenda one, because there is also a task to localize those agendas in the cities. And it is not easy, and combine them when localizing them. So there is the task and the challenge to bring the biodiversity agenda together with the climate agenda, and then both together with the new urban agenda, and bring them down to the territory, and having health as a central piece of this localization. This is our conceptual task, I would say, political policy making task. And I bring an example in my 4 last minutes. I'll try to bring an example. The city of Belém is probably the most famous city, at least in South America, maybe in the world, because it will host the conference, the climate conference in November of this year. So what we're doing there, we are supporting the city with its climate, we call it climate compliance. It means how the city is responding to the Paris Agreement. So we have provided, with the support from the European Commission, the GHG inventory. And look, this is a city at the Amazon, at the heart of the Amazon. And transportation is still the great source of GHG emissions at the Belém. Of course, if you look at the other factors, waste is also very important, which means the local government has much to do to reduce emissions in that case. But if you look at the map of Belém, it is a city surrounded by water. It is a city which has 40 islands in its urban perspective. But the most urbanized area is this south of Belém, where you have also the informal settlements or the favelas. And this is the risk analysis for Belém, and it is provided with the support of the EBA fund, IUCN managed, and German government IKI fund funded. So the risk analysis, I chose only 2 periods to bring to you, but they are materializing itself drastically at the same region of the city. So the same region which is touched by flooding is also in different times of the year touched by heat waves. And it is also the piece of the city where we have less nature. We also map the ecosystem services. This is an illustrated map, as you can see, but this reflects how nature is there embedded into the urban area of Belém. And if you remember the previous map, the south of Belém, the most urbanized area, is where also we have a few favelas, is where the risk is higher for every period we analyzed in the city. So the answer is, of course, to combine prevention infrastructure measures with nature, and this can be through local protected areas, arborization programs, ecological connectivity, urban food systems spreading into the urban areas, a reconfiguration of the urban dynamics of the city, where nature becomes, of course, a very important piece of it, and also a source of health for the citizens. And then we have the climate action plan. And from what I listened, I could have brought different actions, different targets that we supported. Actually, the city did it with our facilitation and technical assistance. But I bring it actually the environmental education, as we see that awareness is one of the factors that much matters in this case. We are working at schools. This is a program that we have in South America, together with an organization called Plant for the Planet. And this brings the possibility to children from 7 to 12 years to learn about climate change in a global-wide perspective, but also in a very precise perspective on their schools, their community, and how it is affecting their lives. So another thing we're doing in this case with Google sponsorship is installing sensors that are supporting to measure the air quality in the city. So this is combined with the GHG inventory and of course installed where the emissions are higher in terms of the transport and the waste routes, so that we can collaborate in this correlation between the air quality, emissions, and health as well. We do have other possibilities to engage our members. This is a more wide one. It is a local protected areas thematic network of ours, where we bring cities to exchange experiences and knowledge on their own policies in terms of park management, local areas management, conservation management, and policies in their own cities or territories. This is it. Thank you very much.